Knock, knock, knock.
Come in.
Hi, my name's Maria. I'm going to be the nurse practitioner seeing you today.
Okay.
Can you tell me your name
Michael Clark,
and your date of birth?
December 20th, 1997.
Okay, and how are you doing today, Michael?
Good, how about you?
Good. Can you tell me why you're here today?
For a physical,
Okay, and do you know where you are right now?
doctor's office.
Okay. So first I'm just going to grab your consent. Is it okay if I do this exam and record it?
Yes.
Okay. Going to do hand hygiene. Okay. So just looking at him, I can tell that his appearance is within normal limits. He has appropriate level of consciousness. He was able to tell me his name, his date of birth, why he was here, and where he was. I do not see any signs of distress right now that are evident. His hygiene and grooming is within normal limits and appropriate for his age and build. His facial expression was appropriate and his posture is appropriate. I don't see any adventitious motor tics or tremors or anything like that. So I'm just going to start with your vital signs. Is that okay?
Yes.
Okay. Okay, so his temperature is 98.1. His heart rate is 75. His respirations are 16. His blood pressure was 120/80, and his oxygen was 100% on room air. Okay, so I'm going to start this assessment and just kind of go head down.
Okay.
So first I'm going to start with your head. I'm just going to inspect. Just by looking at him right now, I can see that his skull is symmetric. I don't see any obvious masses. His hair distribution is appropriate. His eyebrows are appropriate. His eyelashes are going upwards, which is appropriate, and he has facial hair on both sides. Okay, next I'm just going to come a little closer and inspect your head. Is that okay?
Yep.
So right now I'm just looking at his scalp for any lesions. I'm looking for any lice or nits, any masses, indents in his skull. His hair is evenly distributed on his scalp. Any tenderness at all?
Nope.
And it is symmetric. Okay, next I'm going to move to your TMJ joint. So what I'm going to do is just palpate first. Any pain with this?
Nope.
All right, I'm going to have you open your jaw and close and open and close. Okay, so his range of motion is smooth. My fingers were able to drop into the joint and I did not feel any clicking or snapping with that range of motion. Next I'm going to look at your lymph nodes, okay? So I'm just going to palpate. Tell me if you feel any tenderness. And the lymph nodes do not feel enlarged. They are easily movable. Any pain with that?
Nope.
Next, I'm just going to keep going down your neck, so I'm just going to feel. I don't feel any masses, there's no lesions. His trachea is midline. I'm going to assess your thyroid. I don't feel any nodules. Can you go ahead and swallow for me? Good, and his thyroid moves up and down appropriately. And then I'm going to take a look at your cervical spine. I don't feel any masses, no bony protrusions, and no tenderness here.
Nope.
Okay, and what I'm gonna have you do is lift your head up for me, and then put your head all the way back and down, and side to side, and then around in a circle. He has the appropriate range of motion of his neck. Next, I'm going to test your cranial nerves. So first I'm going to start with olfactory, cranial nerve 1. So I'm going to have you occlude one nostril and then tell me what you're smelling.
Hand sanitizer.
Good. And the other side.
Hand sanitizer.
Good. So he was able to tell me appropriately what he was smelling in each nostril. Next is cranial nerve 2, which is optic. So I'm going to test your visual fields. So just tell me when you see my fingers, okay? And
Okay.
just look at me.
Okay. 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 Okay.
Good.
Yep.
He has appropriate vision in all of his visual fields. Next, I'm going to take a look at your pupils. So I'm just going to have you stare at me. Good. 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 So his pupils are equal and reactive on both sides. They are round and 3 millimeters. Okay, next I'm going to have you stand over here and I'm going to test your vision with the Snell chart. Have you cover one eye and tell me as far down as you can, read me the letters.
E L T F P H O L C F D H J B S E F T Z O C F D H J L T F P H.
Good. And then whenever you're ready, the other eye.
E L T F P H O L C F D H J B S E P T Z O C F D H G L F L T F P H.
Good. And he has 20/20 vision in both of his eyes. You can sit back down. Next, I'm going to test cranial nerves 3, 4, and 6. So what I'm going to have you do is follow my fingers with just your eyes, okay? And he was able to follow my fingers in all of the directions of gaze. Next, I'm going to have you look at my finger and I'm going to move it closer to your face. Just focus on my finger, okay? Good. And his pupils constricted when we moved it closer, which means that he has appropriate convergence. Next is cranial nerve 5. So I'm going to have you clench your teeth and move your jaw side to side. Okay. I'm going to poke you with either a cotton ball or the sharp part of the spoon.
Okay.
And I'm going to have you tell me where I'm poking you and if it's soft or sharp.
Okay. Top left sharp. Middle right soft. Top right sharp. Middle left soft. Middle sharp. Middle soft.
Okay. So he was able to appropriately tell me where I was touching him and if it was sharp or soft. So it means he has good facial sensation. Where was the sensation equal on both sides?
Yes.
Okay. And then I'm going to test your corneal reflex real fast. So I'm going to
Okay.
have you look at the wall. Okay. Good. And his eyes blinked appropriately, which means that he has appropriate corneal reflex. Next, we're going to move on to cranial nerve 7. So I'm going to have you raise your eyebrows for me.
Okay.
And close your eyes real tight. And then smile. And then puff out your cheeks. And then stick out your tongue side to side. So he has equal on both sides. There was no droops or anything like that. He was able to raise both of his eyebrows, close his eyes appropriately. Next is we're going to test your hearing with cranial nerve 8. So I'm going to whisper something in your ear and you're going to tell me what I'm whispering, okay?
Okay. 159. HBC.
So he has appropriate hearing in both ears. Next is cranial nerve 9 and 10. So I'm just going to use a tongue depressor and I'm going to look in the back of your throat. Is that okay?
Yes.
Stick out your tongue for me and then say ah.
Ah.
Good. So his soft palate was able to raise equal on both sides and his uvula is midline. And then I'm going to test your gag reflex, okay?
Okay.
Good. And he has appropriate gag reflex. Next is cranial nerve 11. So what I'm going to have you do is shrug your shoulders. Good. And again. Good. And he was able to shrug his shoulders with equal strength on both sides. And then I'm going to have you turn your head towards my hand and good. This way. Good. So he has appropriate strength. Next, I'm going to do cranial nerve 12. So I'm going to have you stick out your tongue and put it side to side and move it all around. And he's able to move his tongue within normal limits. There is no deviation. Okay, next I'm going to just inspect your eyes. So as I can see right now, your sclera is white. There is no obvious swelling, no exudate, no excessive tearing. There's no masses or swelling that I can see. Does this hurt at all?
Nope.
And his conjunctiva is moist and pink, which is appropriate. His iris is appropriate. I don't see any opacities over his lenses at all. His pupils are within normal limits in size, which is 3 millimeters. They're round. They can react to light, which we already assessed in the cranial nerves. Okay. Next, I'm going to take a deeper look into your eye. Is that okay?
Yes.
Okay. So I'm just going to have you look straight at the wall, okay?
Okay.
And I see the red light reflex. And I see the red light reflex in both eyes. Now you're going to feel me come a little bit closer, and I'm just going to inspect inside your eyes. At your optic disc and your retina. Okay, ready?
Yep.
So his optic disc I can see. The veins and arteries are appropriate. I don't see any hemorrhage at all. Good? You okay?
Yep.
I'm gonna come a little closer.
You turn this way a little
Yeah,
bit?
just a little. Thank you. And I can see his optic disc, the arteries and the veins. I don't see any hemorrhagic stuff. All looks appropriate. You okay?
Yes.
I know it can be kind of bright. Okay, next we're going to move on to your ears. So I'm just going to inspect. They look symmetric right now. I don't see any obvious deviations, any masses, any lesions on the skin. I'm just going to inspect a little closer. Palpating the tragus, the outside of the ear. Does this hurt at all?
Nope.
And the skin behind the ear looks clear. No lesions. Again, palpating the outside of the ear. Any pain?
Nope.
And no lesions on the skin. Next, I'm going to take a closer look inside your ear. Tell me if you feel any pain, okay?
Okay.
All right. I'm going to have you turn this
Yep.
way just a tiny bit. His tympanic membrane is clear. I don't see any lesions. It's pink. I see the cone of light, and his eardrum is intact. Beautiful. I'm going to do this side. Again, I see the cone of light. His eardrum is intact, and his membrane is pink. No lesions that I can see. He does have a little bit of earwax, but that's normal. Okay, next I'm going to test your hearing.
Okay.
So I'm going to use this. Do you hear this?
Yes.
Okay. So I'm going to do that and put it on your head, and I want you to tell me if you hear it equally on both sides. Is that okay?
Yep. Yes, I hear it equally on both sides.
Okay. Next we're going to move, I'm going to put it behind your ear.
Okay.
And tell me when you cannot hear it anymore.
Okay. I can no longer hear it.
Can you hear it now?
Yes.
Okay.
I no longer can hear it.
Can you hear it now?
Yes.
Okay. So he's able to hear it longer through air than through bone, which is within normal limits. He does not have any conductive or sensory neural hearing loss. Next, I'm going to inspect your nose. So just by looking at your nose, I don't see any obvious deviation to either side. I don't see any swelling, any bruising. I'm just going to palpate. Does this hurt at all?
Nope.
And the bone and cartilage feels within normal. Okay, and then I'm just going to take a deeper look inside your nose. So I'm going to have you tilt your head up a little bit. Okay, so his membrane is clear. There's no lesions. I don't see any deviation of the septum. It's pink and moist. Other side. Again, his septum looks normal, no deviation. His membranes are pink and moist. I do not see any lesions or masses. Okay. Next, I'm going to have you cover one of your nostrils and breathe in and out, just one deep breath. Good, and then the other side. Good, and he does sound a little bit congested, but that's normal for this time of year. Next, I'm going to look at your sinuses. So I'm just going to palpate first. Any pain or pressure?
Nope.
Okay, and I'm just going to do transillumination. Which is appropriate. And then I'm going to do this one, so maybe look up for me. Good. Good. And I was able to see the light in the oral cavity. Okay, I'm going to move on to your lips and mouth. So your lips look like they are of normal moisture, no lesions, no cracking, no scaliness. I'm going to have you open up your mouth for me. And right away I see that he has all of his teeth. He does not have any missing teeth. His gums do not appear to have any lesions or bleeding. The floor of his mouth is within normal. I don't see any masses, any lesions, any swelling. I'm going to have a look further back in your throat.
Okay.
Okay. Say out again.
Good.
His tonsils are not swollen at all. They are appropriate color. His tongue is appropriate. There's no deviations. His soft, let's look at your soft palate and your hard palate. There's no abnormalities on the soft or hard palate. The pharynx looks good. There's no swelling, no lesions. It's symmetric. And there's no induration on the tongue. So next I'm just going to go ahead and palpate inside your mouth. Is that okay?
Yes.
Okay. So his gums, I don't feel any masses, any swelling. floor of his mouth is soft. He is able to move his tongue side to side. I'm gonna have you stick out your tongue. There's no induration or lesions on the tongue. There's no white patches, so it looks good. Okay, next I'm going to move on to your respiratory assessment. So just while we've been doing this assessment, I have not noticed any signs of respiratory distress. His color is nice and pink. He does not have any cyanosis. There's no retractions in his chest. And he does not have an increased effort of breathing. So first I'm just going to palpate your chest. Can you go ahead and take your shirt
Yes.
off for me? So just looking, it looks like the diameter is within normal from front to back and side to side. I'm gonna have you just take a deep breath. Good, another one. And the chest excursion is symmetric on both sides. Next, I'm going to palpate your chest, just looking for any crepitus, any masses that I can feel. Is this tender at all?
Nope.
Okay, and then I'm going to have you turn that way. Do the same thing on your back. Once again, I don't feel any crepitus, no masses. His skin doesn't have any lesions, no bruising. Beautiful. Okay, next I'm going to percuss. Right, you're just going to feel me tapping on your chest, okay?
Okay.
Good. And the sounds are nice and hollow, which is appropriate. I don't hear any sounds that would indicate consolidation. Okay. Next, I'm going to take a listen to your chest. So when you feel my stethoscope, I'm just going to have you breathe in and out,
Okay.
like normal. You don't have to go fast, and if you start to feel dizzy, let me know.
Okay.
And his lung sounds are equal on both sides. I don't hear any adventitious lung sounds, but I'm going to do the same on the back. And once again, they're clear and equal on both sides. I do not hear any adventitious lung sounds. Okay, next I'm going to do a voice transmission test. So what I'm going to do is put my stethoscope on. I'm going to actually do it on your back again.
Okay.
And I'm going to have you say E every time you hear or feel my stethoscope.
E. 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 E.
And it sounded clear as E, and it did not sound like ah. Next, I'm going to test tactile fremitus. So what I'm going to do is I'm going to put my hands on your chest, and you just say 99, okay?
Okay. 99. 99. 99.
Beautiful. In the back.
99, 99, 99.
Good. And I can feel the vibrations equally on both sides. Okay, next we're going to move on to cardiac. So I'm just going to have you go ahead and lay down for me now. Okay, I'm going to assess his carotid arteries just by looking at it. I don't see any thrill, any pulsations. I'm going to check the carotid artery. Good. Good. And they are equal on both sides. They are not bounding. Next, I'm going to have you look this way, and I'm just going to assess the GVP, which I can see the maximum point is right there. Again, I'm going to feel for thrill, which I do not feel. Don't feel any swelling. Okay. I'm going to listen for a bruit, so I'm going to have you just keep your head to the left. The bell of my stethoscope, I'm going to listen. And I do not hear any bruit, which is considered appropriate. Next, I am going to measure the GVP. So I'm going to have you look that way again. And I am going to put this at the maximum point. And it is 2 centimeters, which is considered appropriate. And then I'm just going to percuss your cardiac region.
Okay.
I'm going to listen to your heart sounds now, okay?
Alright.
So you can just breathe normally. First, I'm going to listen to the aortic. And the pulmonic. And then Erb's point. Percussion and mitral. Heart sounds are appropriate. They're normal S1, S2. I don't hear any clicking, any galloping. There's no splitting of S1, S2, and I do not hear any murmurs. I'm just going to test for bruit now in the same locations. Good. And then I'm going to go ahead and have you lift this arm and lace on your side, on your left side, like over your head like this. I'm just going to listen for any murmurs again. And I do not hear any murmurs. Okay, you can turn back on your back. We are going to move on to your abdomen. So right away I can tell that your I can move these a little bit if you need.
Thank you.
Okay. The contour of his abdomen is within normal. It's not distended on one side or both sides. I don't see any pulsations at all. There's no bruising. The hair is appropriately distributed. Okay, I'm going to listen to your bowel sounds in all 4 quadrants. I'm just going to feel my stethoscope, okay?
Okay.
And his bowel sounds are normal, active in all 4 quadrants. Next, I'm going to listen over your aorta and your renal arteries for any bruits. So we're going to start with the aorta. And I do not hear any bruits. We're going to move on to the renal. No brewery. And the other renal. No breweries. And then the iliac. No brewery. And no brewery. Okay. Next, I'm going to percuss in all 4 quadrants. So again, you're going to feel me tapping, okay?
Okay.
And then I'm going to assess for your liver. So I'm just going to feel. And his liver does not appear to be enlarged. Okay, next I'm going to palpate, so you're going to feel me touch lightly, and then I'm going to go a little bit deeper. Is that okay?
Okay.
Any pain with this?
Nope.
Okay, I'm going to go a little deeper. I don't feel any masses. Any bulges anywhere. He does not have any rebound tenderness. Does that hurt at all?
Nope.
Okay. Abdomen is appropriate. Okay, next I'm going to palpate the spleen. I'm going to have you put your arm out. And I do not feel any enlargement of the spleen. Okay. I am going to have you sit up again.
Okay.
I'm going to palpate your kidneys on the back. Once again, I don't. Do you have any tenderness back here?
Nope.
Don't feel any enlargement of the kidneys. There's no flank pain. And then I'm going to assess the costovertebral